exceed 54 degrees centigrade. 54 is about warmness, a little bit hot, that sort of thing. And that's all you need this thing. And ideal is about 47 degrees. 47. That's about 47 degrees centigrade is the temperature. Have you all been to India? Have you been to Delhi? You know, in Delhi, during that summer month, you walk on the road, it's 47 degrees. That's not the temperature we are talking about. Temperature where a human being will not fall dead. Alright, and your bone will not. So that means, in other words, what I'm trying to get at is got to be low temperature. Alright? When you cause heat damage, when you have too big a hole, you get fibro-osseous tissue. Fibro-osseous tissue is fibrotic tissue. That's fibrous tissue which attaches your implant to your bone. And fibrotic tissue is not the ideal. You want osseointegration. And fibrotic tissue means that eventually your implant will fail. Your implant will look nice, function well. 6 months later, 1 year later, the patient says, my implant is all loosened up. Studies have shown that when you do conventional implant, so long as you get something like 50% osseointegration of the implant, your implant will succeed. 50% osseointegration. So therefore, the better you are at doing your work, getting 60, 70%, and they say the best implantologists will get about 60 to 70%. Very rarely you can reach 70, 80%, 90%, or 100% of osseointegration because of the negative factors. And therefore, you also want to make sure that you're going to be squeaky clean. In other words, the surgery will be squeaky clean. Your hygiene protocol must be the best. And you need 1 millimeter of bone on either side. So you need to measure carefully. Weaker bone results in poor distribution of forces of vesicle, result in eventual failure. When you do osteotomy, especially when you have got other teeth around, make sure you do not damage the roots of the other tooth, or else you'll be sued. The highest amount of litigation cases today in England, America, Europe, Singapore. I don't know Hong Kong, I cannot speak for Hong Kong, but you can find out because NPS covers Hong Kong also. The highest amount of litigation is conventional implants. Today when you do conventional implants, I do implants, which includes conventional implants. I pay my premium to NPS. You all also pay to NPS, right? Yeah? Is it NPS? NPS. We pay 10,000 Singapore dollars. That's about 8,000 US dollars. If you are doing conventional implants. If you are doing ordinary dentistry, you pay less than $1,000. So you are paying something like 10 times the amount. Because the litigation cases for implants have gone up. Well, there are many more dentists who are doing implants, conventional implants, and they are failing. Because they hit natural teeth root, because they do endodontics, you put implants in, it falls off, you get it loosened out, you get infection taking place, a whole host of this thing. So therefore, they give you a whole list of things that you have to follow. The protocol will be followed very strictly to ensure success. But the bottom line is how good you are. The more you do, the better you become. Start now. If you want to do conventional implants, start now. Forget about the more complex ones, do a simple one. Simple, standard, study the thing, go to the company and ask them what are the products you need. It's all there. It's all in the text, in the brochure. Buy the stuff, hunt for your cases. Hunt for your cases. If you don't have enough bone, do your bone augmentation first. Sinus area, low sinus cases, forget it. You still got patient who's got very thick bone. You want to use it. Lower jaw, see where's the position of your inferior dental nerve and your mental foramen. And once you have determined all this block of wood is the perfect thing. All you have to do is do your bone augmentation. That's all. And I would also recommend to all of you all, which I do as a routine today in extraction cases, whether the patient is going to be an implant patient in the future, I always talk to my patient and say, look, when you lose your teeth, what happens? Within 3 months, resorption takes place, the whole area becomes very thin. Am I right? Those have done extraction. So today, what I do is I tell my patient, you know, whether you're going to make dentures or whether you're going to make implants later on, I would suggest that we put these crystals into your socket, we stitch it up for you. That crystal allows healing, number one. Number two, it prevents bleeding. Number three, your bone will remain as thick as possible. So when you make dentures, we don't need to make artificial flanks. It will look very natural. How much more have I got to pay over and above the extraction? Another $100, $150. That's how Singapore dollars. Patients normally will turn on unless they're poor. They say yes, go ahead. And you know you have put it in. Later on when you see the patient again, they don't like the denture. You want to put conventional implant, you've got a nice big thick piece of bone for you to do your conventional. You want to do your mini implant, you've got even a bigger, thicker piece of bone for your mini implant. So whatever it is, you have good bone. So this is a recommendation I can tell you to always don't leave extraction site unattended to. Recommend putting in something and stitching up. You make more money, for one thing. You've done a better service for your patient, and everybody is happier because they've got a nice thick piece of bone. Alright? Remember your OPG is only a two-dimensional figure, so you must be able to visualize three-dimensionally. And the other factors that ensure success is adequate blood supply. In other words, when you start cutting your bone or osteotomy, you burn off the blood supply, you are bound to fail. So make sure that you do not cause damage to that. Minimize bacterial infection. Bacterial infection is a no-no in conventional implant. And micro movement. Remember, your lower jaw, both for mini implant and conventional implant, the lower jaw there is this micro movement that can take place. The lower jaw particularly. That the jaw itself will move by itself. Because it is just a bar of bone that runs across. And patients that find out, especially when they got resorption and the bone becomes smaller and smaller, is micro movement. That's the reason why whenever I put my mini implant, whenever I put my implants, a conventional implant, you must stabilize it. So that anything beyond 60 micron movement will bring about failure of either mini implant or conventional implant. So you must be very careful that you do not bring about that sort of this thing. Your prosthetic part, remember whether it is mini implant or conventional implant, it should be passive fit. In other words, it should go in nice fit, but it cannot be fit that you have to force it in and out. You can only do that in crown and bridges of natural teeth. Why you can do that in natural teeth? Because you are dealing with periodontal ligament which can give. And if you you have managed to force a crown in and cement a crown or a bridge, I'm talking about an angle, the pressure is on one side, patient will feel the pain. But after 2 to 3 months, remodeling of the bone will take place, new bone will form on the other side, here dissolve, and then new bone will again form, new periodontal ligament will take place. It doesn't happen in conventional implants or mini implants. And what happens is that you get hydrolysis of bone. In other words, the bone is pathologically dissolved away, and there's no recovery. There's no recovery in case of this. So remember that you need passive fit. And external hacks and internal hacks, studies have shown the external hacks method cause osteolysis again. In other words, there is the resorption of bone, and the suspicion today is due to bacterial growth around the external hacks, and that bacteria do penetrate from the side. So still your best bet if you're doing conventional implant is to use internal hacks system. The internal hack system would be the best solution.